And hello and good day mga arthritis warriors. I'm Dr. Jonathan Flor-de-Lis. You can call me Dr. Joff, and welcome to our live session on hip arthritis, hip pain, groin pain, and this is gonna be our Facebook Live also para sa arthritis warriors and AVN warrior community. Now we are going to start immediately. We're going to go and deep dive into the things that can make your hip pain, hip arthritis pain less. And it's not a magic pill. No. I'm sorry, it's not a super supplement, and it is actually something that you can do at home. Yes, it is exercise. And the thing is, if you have more muscle around your hip, you have inherently more stability and therefore less pain. Comment down below if you are hearing me loud and clear. What city are you from? I'm here in Cebu City, Philippines, and I want to know if you guys are also from Cebu City, also from the Philippines, from the provinces. We have different viewers around the world. A lot of patients, especially after COVID, have had a lot of hip problems, hip arthritis. And there's always patients with hip fractures. I see hip fracture patients twice a week. So a little exercise can also help patients avoid hip fractures. Strengthening the muscles will also strengthen the bones. It's not rocket science, no? So again, if you can hear me loud and clear, comment in the chat below where you're from, and if you have any questions regarding hip arthritis and hip pain. We are going to do a group of exercises, and these exercises will help patients with hip arthritis. Now, patients fear movement, and the thing is, you shouldn't fear movement. Motion is your lotion. Movement should be your medicine. So the point that I'm trying to make here is a lot of the pain can go away if you can strengthen the muscles around the hip. But this changes everything. The first point, the first exercise I want to do with you guys is a hip exercise called simple leg raises. So we're going to do some leg raises, and this exercise is simply raising the legs, and you don't need to do it super fast. You can do it slow. So simply get a yoga mat, or you can actually do it in bed and do the leg raises. I like to do it super slow for strength purposes. So if you're doing super slow exercise, I'm gonna just put the camera here. We're going to do slow leg raises. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you should be hitting this muscle here. It is the gluteus medius. And after 10 seconds of holding it, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're going to put it down slowly. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So doing these simple hip exercises. Now, this is a exercise that can really strengthen your hip joint, because it is also the gluteus medius that helps you balance. So if you have a problem with balance, strengthening the gluteus medius is something that can really improve your hip osteoarthritis pain. Now, if you want to strengthen the quads, you can also do simple straight leg raises. So on a chair, you can just sit down, and simple leg raises will be just raising. It can be good for knee and hip osteoarthritis. And again, go it up and hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And go down. Do 10 reps of this and do the other side. After 10 reps, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So if you can do it with me, don't be shy. try to check if you have the muscle, if you have the strength, because again, these exercises are not for everyone. There is no single exercise for all types of hip arthritis, and not everyone can do them. If you do experience pain when doing these exercises, you want to just stop and really consult a health professional near you, an orthopedic, rehab doctor, PT or physiotherapist. Again, there is no single exercise that is best for all types of arthritis. But right now, these are evidence-based exercises that can help you. The straight leg raises, the side leg raises, and we can also do what we call glute bridges. So the glute bridges will strengthen the back of the hip. So these are the extensor muscles. So we're just going to do glute bridges. We're going to slowly lift the buttocks there and slowly lift them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And slowly go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now repeat this for about 10 reps. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Make sure that you're creating a space underneath the buttocks, holding them for 10 seconds, and slowly go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So it's 10 seconds going up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Another 10 seconds holding this space. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And slowly going down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, so mga arthritis warriors, those are the 3 exercises that I would recommend for hip arthritis and hip pain. Again, not one exercise is best for everyone. And I'm going to change quickly, and we're going to go on a deep dive, not just regarding, what do you call this? Not just regarding the muscle, but also the hip joint. So we're going to go to the table. I'm going to explain to you. I'm actually still in my residence here in Cebu City. And if you can hear me, mga arthritis warriors, let me know where you're from. Let me know if you guys have hip pain, if you have groin pain. All right. So I'm live here in Cebu City. Dr. Jonathan Flor-Delis. Again, you can call me Dr. Joff. And we are going to discuss this hip arthritis masterclass. I'm just gonna wipe a little bit of sweat from the exercise I had. I hope you guys had a good workout this morning before joining the live. Really good to get some exercise, some sunlight, some vitamin D. And now, for our hip masterclass, a lot of patients I have this little flip chart here. So it's an education flip chart on hip osteoarthritis. And this is showing a normal hip joint. So this is the normal hip joint here. So this here is the normal hip joint. Now, where is this normal hip joint? This is actually the groin area. So that is where the true hip joint is. It's in the groin area. So you can check it. It's right around here. And the very interesting thing is patients with hip arthritis or true hip pain have the C sign. They actually cup their hand and just tell me that, Doc, my pain is here, just around the groin area. So if you have patients with groin pain, that may be true hip pain. They usually cup. This is the C sign. And they point around this area here. Now, contrary to popular belief here in the Philippines, a lot of patients think that the hip is this big bone here. No. So this is actually the pelvis. Maybe it is part of the hip, but it is not the true hip joint. Moving further, when you have healthy cartilage, because of arthritis, it becomes painful. And let me flip it out. Now here is an arthritic hip. You'll see the damage in the cartilage. And again, let me show you the difference. If this is a normal hip joint, nice socket here, and this is a nice real ball part here. This is normal cartilage of the hip joint. And you will see a hip joint with severe arthritis. And that is this one here. You can see the damage in the socket. You can see the damage in the head. Now you put these two together. Normal hip joint, round, deformed. The head is deformed if you have severe arthritis. And you can also compare both when you have a normal hip joint and a very arthritic hip joint with damage. So that's the damage right there. Now moving on to the questions that we have for our live audience. So again, guys, if you're getting value from this live, please like, follow, and share this with your friends. And especially those people, those friends that, or family that might have hip pain, groin pain. Remember that true hip pain is actually in the groin. And they might have, osteoarthritis of the hip or something even worse. If you've had trauma, it might be a fracture. Just yesterday, someone was asking because they fell from the bathroom floor and could no longer get up. They had groin pain, and that pain from the groin was actually a fracture. So let's take a look at the questions that we're answering for today. We're answering questions on hip arthritis, hip AVN. Comment below your city, your country, and ask your question if you do have questions about osteoarthritis of the hip, osteoarthritis of the knee, so that we can answer these questions. Now, AOS, knee osteoarthritis. Yep. Now we're going to go through the guidelines for the hip osteoarthritis and answer questions from our audience. So right now we've talked about the 3 best exercises, and that's why I have a little bit of a sweat going on. I did my exercise this morning. Hope you exercise as well. Remember, the 2 things that we're promoting are not really medicine and surgery. We're going after a lifestyle change. We want you guys to make movement as your medicine. We want you guys to understand that real unprocessed food instead of your drugs or painkillers. Of course, we can't go without painkillers all the time, but we do our best. So, part 3 is, next question. We've done the exercises, we've done the demo, and we're going to go on a deep dive on pain management that works. Yes, you can take painkillers. I'm not saying that you get rid of the painkillers. The question here is, Doc, my groin pain won't quit. So my groin pain won't quit. I'm having trouble sleeping. Yes, you can take your injections. You can get NSAIDs, non-steroidal, anti-inflammatory. Those are the pills that the doctors give you. We actually prescribe these pills for patients who are still in pain. And which one of these medications actually help? NSAIDs help. Usually, I give COX-2 or some naproxen. COX-2 are like celecoxib. Some in the Philippines like to use eterocoxib, which is not available outside. Ibuprofen and Tylenol also help. So there is a strong recommendation still from the AAOS, that's the American Orthopedic Guidelines. Yes, you can take painkillers as long as they are prescribed by your doctor. Do not self-medicate. A lot of patients in the Philippines self-medicate. They take their own painkillers because they were advised by their neighbor, their mother who is not a doctor, a friend, and they can end up, I kid you not, they end up with kidney failure, they end up with ulcers that are bleeding, and this becomes a nightmare medically. So yes, you can take your oral painkillers. There are, of course, some topical NSAIDs if you feel muscle pain, but that's not going to go deep into the joint. Remember, the joint is very deep. Number 2, what about cortisone injections, doc? So cortisone injections are powerful, but still they are temporary, meaning you get injected in the joint. So for severe arthritis, you get injected in the joint with a needle, and it does not cure this arthritis. It actually makes the pain less. It is a strong pain reliever, and this strong pain reliever can give for some months of pain relief. Rarely 6 months to a year, but every patient is different. So I don't go saying that this is going to last for 6 months to a year. I actually tell my patients that, yes, this can give you some temporary relief up to a certain point, but I don't say an actual number of months or weeks or a year. No, I don't say that. Every patient is different, and some patient may have very mild arthritis, like this here is very mild arthritis. So you have very mild arthritis here. This is just the damage. And you have patients with really severe arthritis. The cortisone injections will not work for patients with severe arthritis. So, mga arthritis warriors, you have to go to a doctor. You can get prescription meds for the pain. You can get a cortisone shot or some injection for the pain. And those are the recommended. Number 3, doc, what about these gel injections? Gel injections are hyaluronic acid injections. They are less studied for hip pain. The hip joint is very tiny, and so they have mixed results. There is a limited recommendation from the orthopedic guidelines for gel injections to the hip. And there is also a growing body of evidence for PRP, which is platelet-rich plasma. They take your own blood, they clean it, and they inject the platelet-rich part back into the joint. It is working for some. Again, they are still being studied, and they are best for mild to moderate arthritis, but not patients with severe arthritis with severe hip pain. Now, I hope this was helpful to you guys. Again, like, follow, and share this with your friends who have groin pain. Let them know that the true hip pain is not actually sa balakang or pelvis area. It's actually in the groin, sa singit, in the Philippine vernacular, singit, bugan, or punuan. Deep groin pain, that is the mystery. So the question here is, why is my groin pain not going away? Is this not muscle pain, doc? So yes, some of the groin pain may be a muscle, but not all the time. So some groin pain can actually be a more serious condition, like what we are showing you right now. It could be hip arthritis, and the damage over the years builds up, and you have severe groin pain. It is not a side hip pain. It's not on the side. It's actually in the groin. That's why we have the C sign. You're cupping and you're pointing in the groin area, which is here. This is the C sign. Patients usually cup. And the classic pattern of hip arthritis. Number 1, you have pain in the groin. Number 2, the pain gets worse when you're walking. So when you're walking more, you get more pain. And there's also number 3, stiffness after sitting for a prolonged period. You sit down, and when you sit down, maybe it's been an hour. When you stand up, you feel really stiff. And a lot of patients have problems putting on their socks, their shoes. Others can no longer put on socks or shoes, so they use slip-on shoes. The pain can be confusing because sometimes it radiates to the buttock area, the back area, and in the knee. So this is called referred pain, where the pain from the hip goes to different parts of the body. And that is, again, some of the symptoms. Remember that, again, I cannot stress this enough. The true hip joint is in the groin. That's why we have the C sign. Patients unconsciously use this C sign. They just cup their groin here around, and that is a sign. They are pointing to where it hurts most, that is the groin, and they're cupping the hip joint area. They're telling me that it's a deep hip pain. So this is why it's important. It helps distinguish pain from other causes. Usually when patients are showing me the side of the hip, that may be a muscle issue, a lumbar issue, even a spine issue, not a true hip joint pain. So thanks for asking. And next question, when, doc, is the groin pain urgent? So when is the groin pain urgent? When is it when does it need immediate attention to prevent permanent damage to my joint? So if you do have some groin pain after trauma, even minor trauma, it's a possible fracture in older adults. Like I mentioned a while ago, a patient slipped on the bathroom floor and she was 70 years old. She was relatively frail. She could no longer get up from the bathroom. It's a possible hip fracture. Now, the pain that even with rest is really bad, even if you're not doing anything, that's also a sign that you need to see a specialist, a doctor. If your limping is getting worse every time you walk, or you cannot put weight on the leg, this is, again, a possible hip issue. So if the groin pain is getting worse, the limping is getting worse, if you are not able to walk, please consult a doctor, hopefully on the same day. Do not wait. Go to the emergency room. And yeah, these are the warning signs, the red flags when the groin pain is urgent. So let's go to weight loss. And doc, why is 5 kilograms of weight loss important? Now, 5 kilos is important because the hips are massively loaded. So when we walk, our hip joint is actually carrying about 3 times our weight just by walking. And so if you lose 5 kilos, that's immediately times 3 per hip, and it deloads the hip joint, gives you a lot of pain relief. Imagine that. It's times 3, so 5 times 3, 15 kilos. If you lose 5 kilos, that's minus 15 kilo on your arthritic hip. The hip actually benefits more than the knee because the hip is a smaller joint and it carries a lot of weight on a small surface area. So yeah, that is why weight loss is important. A realistic goal is 5 to 10% of your body weight. You don't need to lose a lot of weight. For a lot of my patients, they have issues losing weight, and it's better to refer them to specialists also on weight management. We do now have doctors who specialize in nutrition and weight management. We also have nutritionists that focus on weight management. And the number one thing that can help you lose weight is also cutting off all the sugar for about 3 to 5 days. If you can cut off the sugar and maintain a low carb diet, it's going to be great for your hips. Studies are now linking hyperglycemia. If you're taking a lot of sugar, it can damage your cells in the joint, not just the hips, any joint. That is the connection between the metabolic side that they are now seeing in osteoarthritis. Before, we thought osteoarthritis was just a wear and tear disease, a disease of old age. No, there's actually a metabolic component of this disease, and This is something that is being studied currently. And the thing is, if you have a high carb diet, if you're eating a lot of sugar, ice creams, a lot of soda, a lot of fruit juices that have a lot of sugar, it can damage your joint slowly through time. And this is being studied. For Filipinos, Doc, what diet modifications work for my hip arthritis? So you have groin pain, sakit sa singit, bugan, and you're eating a lot of rice. I think that's the number one thing that we Filipinos eat. It's really rice. I used to take 3 cups of rice with my chicken, and now I have realized that maybe we can live with about 1 cup per meal. We can lessen, of course, our soft drinks because we love our soft drinks. And for the Cebuanos, we have a certain rice called puso that is very delicious as well. So limiting the amount of carbohydrate from breads and rice, this can be the number one tip, that the modification that we Filipinos can do to lessen our weight, lessen the pain from osteoarthritis of the hip. The other thing that we can do, as I said, is a modification not just of diet, but trying to exercise more, walking more. When we look at other cultures, they walk a lot even in their later age. But here in the Philippines, we call a taxi, we call a motorcycle, and instead of just walking 5-10 minutes away. And simply put, we've become a little lazy as Filipinos to walk around. Dancing is an exercise, so a lot of people are doing Zumba. Just be careful that you don't overdo those Zumba exercises. You don't need to be perfect, just be better. Cut the carbs, the rice by half, the puso by half. Walk more, especially now that the prices of gasoline are very high. Even if you have a little bit of groin pain, walking is actually still good for you. Now, I'm telling you this because we want to promote exercise, movement as medicine, motion as lotion, but I understand that not every patient has the same amount of pain. Some have severe pain and can no longer walk. I had a patient who could no longer get out of her room, and these are warning signs. Please see a doctor or go to the emergency room if you have been stuck in the house, unable to move. It is time to get a medical attention for your hip. So this is a special segment we're going today for the AVN Warriors Philippines. It is a silent hip killer, and we thought it was just a rare event, but after COVID, there's been a lot of vascular necrosis. It's a silent hip killer. And after COVID, where people were using a lot of different medications, high dose steroids to cure the COVID, some of these patients are actually coming out of COVID years after and getting groin pain and AVN of the hip. So here are some warning signs to see a doctor immediately. If you have sudden groin pain, you're doing the C, you're doing the C sign and putting your hand here in the hip. That means you have groin pain and you had no injury or trauma whatsoever. That the pain wakes you up at night. That is possible AVN. If you've had a prolonged steroid use, it's also possible that it is AVN. The pain that gets worse, that is a warning sign. Early diagnosis is key when we're talking about hip AVN. So hi sa mga arthritis warriors, mga AVN warriors. I'm also informed that the Philippines AVN Facebook group has been hacked. So we have created a AVN Facebook group for our AVN Warriors Philippines. Now we are calling this the AVN Philippines Hope and Recovery Facebook group. It is free to join, and meet other warriors, AVN warriors like yourself. And of course, we want to help, we want to educate you, we want to inspire you, and we want to help heal each other, whether it's emotional, and of course, help you find a doctor in your area. Moving back, guys, when is it time, doc, for a hip replacement? So yes, we have to talk about a hip replacement because not everyone can be cured with movement as medicine and food as medicine and taking the painkillers, the injections. There are still patients with severe bone-on-bone, bone-on-bone arthritis. When you're comparing your severely arthritic deformed head to a normal head, so this is the normal head here, and a arthritic head here. If you have this already, it's very painful, and that is why a hip replacement we're going to show you here is going to be the next choice. So a hip replacement is when you get your hip joint replaced. Your arthritic joint needs to be replaced, and this is when you have a severely arthritic hip on your x-ray. So I'm going to show you an x-ray with a severely arthritic hip, comparing it. So if you have, this is a normal hip joint here, and compare it with the severely arthritic hip joint there. If you have this hip and you have the groin pain, you're doing this all the time, please see a doctor near you, because that means it may be time for a hip replacement. On x-ray, this is what a hip replacement will look like. This is the x-ray of the hip replacement, and it can give patients quality of life. There's a patient that just commented in the chat, very funny. One of the best exercises she did was to climb on the operating table and get herself a joint replacement. So that's all the time that we have, mga arthritis warriors, mga AVN warriors. I'm Dr. Jonathan Flor-de-Lis. You can call me Dr. Joff. I'm a hip and knee specialist here in Cebu. I do orthopedic hip and knee replacements, and I'm helping patients walk back to life. Let's educate, inspire, and heal. Remember, please like, follow, and share this with your friends. If you found it useful, share with people who need this. Much love and respect. Have a great day, everyone. See you next time. Bye-bye.